Now I'll show you all the tests for the coronary ligament. We'll run through it once quickly, and then we'll go over it step by step, each one at a time. So first we start with heat. Compare left and right. Is there a heat differential? Swelling. Do the fingers move out? If I'm not sure, I might check the other side. Then passive flexion and passive extension. Then lateral rotation and medial rotation. The fronts of our hands vary in their temperature more than the back, so always use the back of your hand to check for heat. So first check the medial side of one knee against the medial side of the other knee. Then the lateral side, and then come back to the other side and see, is there a difference in the heat you feel? Now, the swelling test, you place the upward hand, the hand that's near the head, right above the kneecap. There's a pouch there that collects fluid so that when you press on it, it will send the fluid down. The other hand, use your thumb and forefinger and middle finger on either side of the patella tendon, just below the kneecap, and then you're pressing down to the table and to the foot simultaneously, this way, and see if your other fingers move out. If they're swelling, they will spread out and you'll feel the fluid rushing toward your fingers. Next, we're going to do passive flexion, and always lift the leg gently and be careful because it may be painful when you get to a certain point. So if it hurts, of course you stop immediately. The normal range is for the heel to hit the buttock, and if it does, you're going to give it a little jerk if there's no pain. If you find that there's a little bit of limited range, what you want to do is you want to go to the other leg right away and see, is the other leg limited in the same way? And maybe it means that there's nothing wrong, because you'll not always have swelling when you check for flexion. So then you do passive extension. Passive extension, you place one hand under the back of the ankle, you place the other hand above the knee, and then you press down with the upper hand and you pull up on the foot to straighten the leg. If there's any discomfort, stop immediately. If there's none, give a small jerk, which is only maybe an inch or a half inch, boom, just like that, just a little, and what that'll do is it'll compress any liquid in there, and if there's just a teeny amount of liquid, then you know that there's a little bit of swelling that's there most likely. The passive lateral rotation test is a little tricky, and I'm going to show you two ways to do it. You stand at about the level of the knee, and you're going to cradle the knee. So you lift up from the foot, and you cradle the knee, and you allow it to bend. Then you take the hand that's cradling the knee and you put it on the outside of the heel. Then you flex the foot with the other hand, so the person just relaxes, and you're holding the forefoot. Then you laterally rotate it as far as it will go. If there's pain, there'll be pain on the medial side because you're stressing the medial side. And if there's any pain just stretching it, stop. You've got your information. If not, give it a little jerk, like that. Now you notice that Jen's knee rotates about 45 or 50 degrees. If we take a look at someone else's knee, we could see that their rotation will be greater, and that means that there's a looseness in that ligament. Now, we're going to rotate the other way. So now you switch your hands, put your hand on your heel, and hold the forefoot on the outside, always in dorsiflexion, never down, and you rotate medially as far as it will go. If there's no pain, you give a slight jerk. Now let's try it another way. When you lift the leg and you put your hand and cradle the knee, you then hold the leg up. Somebody might have a very heavy leg. And what you do is you use your forearm to flex the foot. You're holding with the hand on the heel, gripping the entire heel, and you're pulling the foot up with the forearm, and then you rotate it and do the jerk just with one hand. On the other side, you just grip the whole heel and you put your thumb on the outside here, and you're just going to keep it at 90 degrees and jerk this way. So let's try that once more. This way, you're holding the heel, flex the foot, here, give a jerk, just turn the foot around, keep it flexed, and jerk. Many people find that easier, but some find this position easier. Do what works.